if, like me, you've got receding gums or gum recession, do you wonder if it can be fixed or reversed? Gum recession can be uncomfortable, leave you with sensitive teeth and areas where you just look longer in the tooth and it makes you look older than you are. But is it possible? Is it possible to reverse gum recession? And if so, how do we do it? Are there ways of treating your gums and making them stronger at home? Or are the only options to put up with it or have surgery? Well, I've been using my 30 years of dental experience together with hours of research on this topic to find out the answer to these questions so you don't have to do all that legwork yourself. I'm Dr. Rachel, I'm a holistic dentist, and so many of my patients worry about receding gums, and that's understandable. It doesn't look great, and your teeth can be sensitive, and they can hurt when you have cold things to eat and drink. So to answer these questions, we need to look at why gums recede in the first place and put a stop to the issue. Otherwise, the things I'm going to suggest or I have come across in my research aren't going to have the best chance to help. Now, receding gums happen when the gum around the tooth, it kind of pulls back below the margin or it wears off. This recession exposes parts of the teeth and the roots to bacteria, and that increases the risk of tooth decay and gum disease, as gum recession leaves gaps between the teeth and gums where bacteria can easily get down and they live and they're hard to keep clean. Now, in the early stages, it can be quite hard for you to tell if you have recession, but tooth sensitivity is often one of the first signs. So if you've got sensitive teeth, you should really be talking to your dentist about it, not just picking up a toothpaste and hoping for the best. Gum recession is actually something that should be picked up and monitored by your dentist or your hygienist, and that should be happening during your regular checks and your routine cleaning visits. Let's look at the reasons for gum recession. Well, it can be caused by gum disease, and this is where your gums get infected because you've got poor oral hygiene and you've got too much bacteria building up. The gums bleed and they swell and they become fragile, and the infection makes them peel away from the teeth and it damages the bone that holds the teeth in, and as that happens, the gums pull away and shrink away from your teeth. Bone loss, as I've just touched upon, and that can be caused by the gum disease process. So when you get advanced gum disease, the inflammation and the bacterial infection eat away at that bone, and then your gum's got nothing to stick to. Another reason for gum recession is teeth clenching and grinding. And when you clench and you grind your teeth, it swings the tooth from side to side, and that stresses the bone and the gum tissues around it. And like knocking a fence post around in the ground, that can open up a space and cause the gum to recede. Incorrect and poor brushing technique. If you don't brush well enough, you can get gum disease. If you brush too aggressively, too harshly, you can actually wear the gum away and cause trauma and damage. Now, plaque and tartar on your teeth, that's also going to cause problems for exactly the reasons I've just explained about gum disease and irritation. And then there's the type of gum that you have. Yes, your gum type. There are different types of gums, and I'm going to go into that in more detail later, and what that actually means for you, because knowing your gum type is going to determine how best to deal with recession. So before I go into those gum types and what type you have, let me give you a rundown of how to stop gum recession so that we can move on to how to fix it and whether it's actually possible to reverse gum recession at home. Well, what are the fixes for it? Well, at home you can use things like antibacterials, anti-inflammatories, vitamin C, zinc, vitamin D3, collagen supplements, oil pulling, proper brushing and flossing, eating less sugar, and using xylitol to reduce bacterial buildup. Now, particularly with the vitamins and supplements, they help reduce inflammation, but they also provide what you need to heal and also repair and regenerate gums and tissues. We can look at eucalyptus oil. That's really good at effectively treating receding gums, and it is said to promote tissue growth. Omega-3 fatty acids, they're anti-inflammatory, and they help with repair. You also need to be eating good quality protein because that provides the building blocks for growth of your tissues. I go into this in more detail in other videos, so I'm going to link those for you. Now, that was things that you could do at home. What can you do at the dentist? Well, if you've got plaque and tartar on your teeth and you've got gum disease, then we need to have a proper teeth cleaning done. You may need a deep clean to get down under the gum lines and into that space that has formed so that the gums can heal and tighten back up around the teeth. And now we've got a chance of helping to fix the problem. If you clench and grind your teeth, then I would recommend a night guard so that you're not swinging your teeth around in the jawbone and accelerating that recession. There are things like laser treatment and bone regeneration proteins that can be put down into those spaces to try and get the bone to repair and heal, because if we've got bone, we've got something that the gum can then adhere and stick to. Sometimes the option is surgery, and that can be done with a gum graft, where they take a bit of tissue from inside your mouth and then they put that over the receded area. And then there's another one called pinhole surgery, where they get your remaining gum structure and they help to kind of gently tease it and pull it back down or up, depending if it's an upper or lower tooth, but they pull it back into position around the tooth. Okay, so earlier I touched upon gum types and recession, but to explain this, I want you to imagine this. You've got a set of tyres on your car. Over time you drive and they're going to start to wear down, they get thin, they lose their tread, and eventually they need replacing. Now, if you treat those tyres rough with wild and heavy braking and acceleration and cornering, they're going to wear down faster. Same if you drive over uneven or harsh terrain. They wear faster, you might even get a flat. Now, if your tyres are not inflated at the right pressure, they're going to wear faster. But what if you have really thick, chunky, all-terrain tyre as compared to, say, a thin, slick, smooth racing tyre, which is going to wear out quicker? Of course, the smooth one. And it's the same with your gums. You might be prone to gum recession because you've got thin gums. Yes, like me, you might have thin gums. And this is in part due to things like genetics, the alignment of your teeth, and the thickness of the underlying bone. But I like to think that after doing my research for you, that some people have thin gums because we've been pushed into this mindset of brushing our gums gently and using a soft and softer and softer and softer toothbrushes. Thick gums are like the chunky all-terrain tyres. They're robust and they're resilient, and they just don't get recession very easily, if at all. Thin gums are like the smooth, slick racing tyre, and they wear out faster. And so we've been telling people they've got to brush gently, brush gentle, don't brush too hard, use a soft or an ultra soft brush. But I think there's a problem with this. And the problem is when you brush too gently or with a really softy, feathery tickle with one of those ultra soft brushes, it doesn't stimulate the gum tissues. It doesn't stimulate the gums. And they get thinner. And they become more prone to recession. So isn't that the opposite of what we've been told? We've all been told, oh, you've got recession because you brush too hard. You're scrubbing your gums and your teeth away. Well, for some people, yes. But I don't think for everyone. I think the problem is we've got thin gums and we've been too namby-pamby with them. We haven't given them what they need to stimulate them and make them strong and robust. So what if you could make your gums thicker? What if you could give them a chance to grow back before they get worse? What if the advice we've been given and I've given out as a dentist is wrong or inadequate, and that we need to do completely the opposite of what we've been told? Are you sitting there going, I think this Dr. Rachel girl's mad. I think she's lost it. Well, maybe I have, but wait, let me offer some science here. Let me explain why, and I'm going to give you a two-step approach to help you to grow your gums back. Now, step one, and the science behind it, I would like to begin by looking at the kind of toothbrush you have. I want you to make sure your toothbrush isn't too soft. You need a brush that will be able to stimulate and massage your gums, because this is how you're going to increase both the blood flow into the gums and their actual blood supply. And this is how we make them grow. This is important for two reasons. Firstly, the increased blood flow brings in nutrients and oxygen and all the things that you need to help repair and heal your gums and help them grow. Secondly, when you massage the gums with the toothbrush, you get new blood vessels growing in the gums. And this is a process called angiogenesis, where the existing blood vessel grows new blood vessels. And this in turn thickens your gums as more tissue can grow. The blood vessels grow, they act like scaffolding, which then can support new growth of gum tissue and gum structure. And this is why it's super important to have plenty of protein and collagen and vitamin C in your diet, because this helps the new gum tissue build and latch on to the scaffolding. So, if you massage the gums well with a robust toothbrush, you're going to stimulate new blood vessel growth, and those new blood vessels can bring in the necessary building blocks that your gums need to regrow, even if you've lost bone. Now, it could also be possible that if you can regrow the gums, can you regrow the bone? Well, maybe yes, but you can't regrow the bone until you start regrowing the gums. And for both to regenerate, it isn't far-fetched or impossible, and we won't know until we try. Now, the key here is if your gums are very fragile, they're very thin, they're sore or they're tender, we need to get them healthy first. And then you start by gradually increasing the amount of force and pressure that you use when you're massaging the gums. So at first you might just be switching from a soft brush to a more medium brush, but using the same amount of pressure. And then you build up and build up. I don't want you to go to a super hard toothbrush because they can be too aggressive, but I want you to think about massaging and stimulating your gums. So what type of toothbrush do you need? Well, I've just said it. Ditch the soft one. You know, the one you've been told to use because you have gum recession. Because it seems that by using these softer brushes, it's actually making the recession worse, because we need to stimulate the gums. We need to get the regrowth of the tissue. And you can only do that with a firmer brush that is stiffer to use. You've got to get rid of any infections, any gum disease, and any decay that might be there in your mouth. You've got to do that first. And you've got to then help to replace the protective biofilm and pellicle that is over your teeth to help your gums grow back. That's part of step 2. And I'm going to go through that. I'm going to explain what pellicle and biofilm is for you as well. But before I do that, let me say this. Don't wait. Don't wait until you can see half of your root and your gums are completely peeling off your teeth. Start this the moment you see or suspect any recession, or your dentist picks it up or your checkup. And if they don't mention it, ask them, excuse me, do I have any gum recession? Because even if it's only 1 millimeter, you want to know so you can fix it before it becomes too late. So let's look at part 2 of fixing gum recession. The first part is massaging the gums, getting a firmer toothbrush, but we have to provide the right environment for those gums to be able to attach to your root and back to your teeth. And to do this, we need to rebalance the bacteria and the biochemistry in your mouth. Now, that might sound complicated, but it's actually not that hard. So for the gums to attach back to the root, we need to put a layer over the root of the tooth, and this is called pellicle and biofilm. This is basically layers of proteins and minerals and good bacteria, and they form this protective film. The mouth needs to be alkaline and not too acidic to do this. So we need to make sure that you're drinking plenty of water and you're getting good nutrition and you're not having things that are too acidic. You need to be using, for your oral care, you need to be using more natural products, toothpaste and mouthwashes. Maybe try some oil pulling. Use hydroxyapatite toothpaste and xylitol mints after meals, because that's going to alter the environment. It's going to keep the bad bacteria and the acids they produce at bay. And then your gums are going to have a chance to be like little rock climbers, hanging on and having a foot and a handhold to hang onto and reattach and grow. Now, the gum massage, that can thicken your gums, it stimulates the growth of the blood vessels, and it allows those gums to climb back up. But they've got to have the right surface that they can attach to, and that's what all those other things I mentioned are for. Now, I know you're going to want to know more about xylitol and how to use it and how to rebalance your mouth health, so check out this video here, and in the meantime, get that firmer toothbrush, massage your gums and stimulate them to get thicker and repair and fix your gum recession at home.